Chapter 14, this is health problems of toddlers and preschoolers. And one of the big problems at this age is infectious disorders, that being communicable diseases. We have pretty good compliance with immunizations and immunizations for most of the most serious infectious diseases, and because of that, there's actually been a decrease in the incidence of a number of communicable diseases. So the incidence has declined, and the number of serious complications has also decreased. We're better at treating the complications that do occur with antibiotics or antitoxins. Some of the different communicable diseases we look at or we see in this age are chickenpox, which is caused by the Varicella Zoster virus. It's transmitted through respiratory secretions, can also be from direct contact with the patient, and from airborne droplets. So if the person coughs, sneezes, talks, anything that spews out small little airborne droplets, those can float quite a ways in the air before they settle. And that's why we treat this with respiratory or droplet isolation, where you have to wear a mask if you're going to go in the room at all, because unlike a lot of things where the patient sneezes that goes a couple of feet out and drops, these can float considerably farther out in the air. And then also contaminated objects. The incubation period is between 10 and 21 days. And this is part of the problem with these illnesses. You get exposed, you don't break out for a week and a half to 3 weeks. It's really hard to stay home and do nothing from 10 to 21 days after exposure, just in case you're going to break out. So kids don't, but the period of communicability, they're contagious 1 day before the rash. So this is before the parent knows for sure they have that they've gotten chickenpox. They're already contagious. They're out spreading it around, not knowing that they have it. And then they continue to be contagious for about 6 days after the rash. So it's about a week. It's until the rash is all scabbed over and dried up. Some of the treatments, acyclovir, which is an antiviral, because remember we're dealing with a virus, not a bacteria. Tylenol for itching, Tylenol for temperature and discomfort, Benadryl for itching. Fluids, making sure they stay hydrated. Strict isolation, this is highly contagious. And then prevent scratching, because they'll get secondary infections at the pox that they scratch. And no aspirin. This is one of the viral illnesses that's closely associated with Reye's syndrome if parents use aspirin to treat it. Here's some pictures. He's pretty well scabbed over. He's probably not contagious anymore, but those big spots, those are secondary infections. He scratched those and got germs into those. This is one of the big problems. If they get the pox in their mouth, it's very painful to eat and drink, and those are the kids who usually end up in the hospital because they need IV hydration because they're just not taking anything by mouth. And here's pretty well healed pox. One of the problems with chickenpox is it's a virus that once you have it, it stays in your body forever, and it can resurface, particularly at times of stress when your immune system is not working well. And what it does is it pops out along a nerve line in the form of shingles. And these are shingles. And shingles can be extremely painful because it's on a nerve, it's on the nerve line there. Those nerves can be stimulated, causing pain, and sometimes it'll be for months. Usually not, and usually it's something that happens with older adults, but it really can be any age. Okay, another one that we see, Erythema infectiosum, which is called fifth disease, or what people will call it is slap face or slap cheek disease. This is by parvo. It's parvovirus B19. It's not the same parvo that your puppy gets, but it's in the same family. It's transmitted by respiratory secretion. So somebody coughs, you pick it up on your hand and eat your lunch without washing. Incubation is anywhere from 4 to 21 days. So again, because of these long incubations, it's really hard to not, go out and spread it around because you don't think you're going to get it because it's been almost 3 weeks since you're exposed. The characteristic sign is the slapped face appearance. They get bright red cheeks. Communicability before the onset of the rash, that bright cheek rash, and then there's also a body rash. So again, you don't realize you have it, but you're already contagious. It's normally an uncomplicated illness. It's not a big deal unless a pregnant woman gets it for the first time during the first trimester of pregnancy, and then it's really quite serious. You can see her red cheeks, and she's also got a fine, flat, lacy rash on her trunk. Roseola. This is comes from the human herpes virus type 6, and its incubation is anywhere from 5 to 15 days. It usually has a high fever for about 3 days, 3 to 4 days, and that's the first sign, and that's all they have is this persistent high fever. After the fever subsides, then they develop a rash. The rash will first start on the trunk, then move to the face and the extremities, and you can see a bit of the rash there. It's kind of little red, it's slightly raised, but individual red spots. Rubeola. This is our MMR, measles, mumps, rubella. The measles part is rubeola, and this is a viral again, and it's the source for getting it is from secretions from an infected person. It can also be droplet transmission, so they talk, they cough out into the air, and you inhale the droplet in the air. The incubation period is from 10 to 21 days, and again, you're communicable from 4 days before to 5 days after the rash, and that's what makes these so communicable. Parents don't realize how sick that they're sick until the rash comes. This has these things called Koplik spots that appear about 2 days before the rash. They're a red spot with white center in the mouth, and that's a helpful sign for diagnosing. I believe there's another, no there wasn't, and I thought there was a picture of the rash. Another one, mumps, again measles, mumps, rubella, so this is in that same immunization. This is the paramyxovirus, and it's transmitted also by droplet, so coughing and it floats out in the air, or direct contact. Its incubation period 14 to 21 days. You can see all of these have long incubation periods, which is why they're so hard to stop them from spreading. What kids get with this is fever, headache, malaise, and then they get the parotitis. The parotid glands, which is the salivary gland, kind of behind the tongue or the sides of the tongue, that's what swells up. And they get this huge swelling that you'll see on the outside of their neck from that parotid gland. Now the big problem with this is boys, especially if they get a little older, puberty or later, they'll get orchitis from it, which is in the testes, which usually or very often leaves them infertile. It can also turn into meningoencephalitis, which again can be extremely serious. Pertussis, commonly known as whooping cough, and you probably know there's a pertussis outbreak right now in Fresno County, and so we are giving everyone who needs a tetanus shot, they're getting the full DPT or DTP or whichever, DTAP, Tdap, whichever version they have of it, but the shot with pertussis, not just for the tetanus, and that is because of this pertussis outbreak. The causative agent, this one's bacterial, Bordetella pertussis, and it's transmitted by droplet or direct contact. So again, you cough, it floats out in the air and somebody breathes it in. The incubation period is between 6 and 20 days, and it's characteristic of these coughs that are followed by a crowing or a whoop sound. And if you take care of a kid at the hospital with pertussis, they are scary. They cough, 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 without taking a breath, continue cough, 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 and finally when they're turning red or purple, they'll go, "Ugh!" and start coughing more. Their spells can be very bad. The most severe complications from this is if it turns into pneumonia, so it settles down into the lung, and they have a very high mortality rate the younger they get this. So kids who, the first shot is usually at 2 months, kids who get it before 2 months, many of them will not survive it. Scarlet fever. This is one of our strips. The group A beta hemolytic strep, which you talked about last semester in OB, is the cause of scarlet fever. Usually it starts nasopharyngeal, so you get it in your nose and throat, but it doesn't just turn into tonsillitis. Instead, it progresses and goes systemic. The incubation period for this is usually between 2 and 5 days. It can be anywhere from 1 to 7 days though. And again, it starts as that strep throat, which usually is a tonsillitis, and your immune system keeps it there in your tonsils. But if it doesn't, the toxins from the strep go throughout your whole body and cause all these other symptoms. It's treated with penicillin or erythromycin, and amoxicillin is a synthetic penicillin basically. So that's what you'll probably see used on a kid. We put them in isolation until they've been on antibiotics for at least 24 hours, and that's true of the pertussis as well. Anything that's bacterial, we're going to have them on antibiotics for 24 hours before we've weakened that germ enough that it can't be transmitted from one person to another. The complications with scarlet fever is this is now systemic. It can settle in the heart and cause carditis. It can kind of make a pocket behind the tonsil that becomes an abscess, peritonsillar abscess, or it can settle in the kidneys and you get glomerulonephritis. I actually know someone whose son started having blood in his urine, and they took him into the pediatrician, who did a strep swab on his throat that was positive. Scarlet fever, they get this strawberry tongue with the little white dots on it and a rash over the whole body. It's this fine lacy rash. And when we're trying to figure out what a child has, the nursing assessment in identifying the infection, we want to find out what they've been exposed to. And we need to ask them in the last 3 weeks or the last month, because it's not just the last couple days on a number of these, as you saw. And ask about prodromal syndromes. What happened before? What were the early symptoms? Because sometimes there may be, the 3 days of fever followed by the rash, or they're knowing what happened. Those things that happened before they came in may help us in identifying what it is. We need to find out about their immunization history. If they're fully immunized for certain infections, well, then we need to think about other ones, and we can rule out those, or if they've had a history of the disease. Most of these are things you get once your body knows